Dr. Bhaskar on incidence of aggressive ROP and management with biosimilar. Next speaker, I would request Dr. Pragati Raj to be ready for the next talk. On the podium when almost he finishes, maybe after a couple of minutes.
Good morning, everybody. Thank you, AIOS, for giving me opportunity to present my study on incidence of aggressive ROP and management with biosimilar ranibizumab and laser in tertiary eye center in Eastern India. So ROP is a vasoproliferative disorder of premature low birth weight infants featuring abnormal proliferation of developing blood vessels at the junction of vascular and avascular retina, with key factors involved are VEGF and insulin-like growth factor type 1. According to ICROP, these are the ROP zone classification, and these are the stages of ROP. According to ICROP, aggressive posterior ROP is a severe variant of ROP which includes zone 1 and posterior zone 2 with increased dilatation and tortuosity with posterior pole vessels in all 4 quadrants and a rapid progressive course. Biosimilar ranibizumab is a recombinant humanized IgG type 1 monoclonal antibody which is formulated for intraocular use of DME, CNBM, and macular edema. Innovator ranibizumab still remains a cost-prohibitive option for a majority of population in developing country like us. Aims of our study was to find out the incidence of aggressive ROP among the all screened premature children, babies, and efficacy of intravitreal biosimilar ranibizumab, followed by panretinal laser treatment of for this babies. This was a retrospective study carried out in a Vitreo service department in the tertiary eye care center in Eastern India after local ethical committee clearance and informed consent from the parents of the babies. We calculated the incidence of aggressive ROP, and the infant was given intravitreal biosimilar ranibizumab, and after weekly follow-up in case of persistent avascular retina, laser photocoagulation was done. Treatment of aggressive ROP babies being done with injection and laser. Among the 522 babies, those were screened for the study, 24 babies was found to have APROP disease, who were given ranibizumab injection, and after median of 5 weeks, they were lasered. In 50 babies, we found type 1 disease, who were given laser only, and for 448 babies was normal. Complete resolution of ROP was seen in all 48 eyes. From the data from 48 eyes of these 24 babies having APRP was analyzed, and was found that after 5 weeks after treatment, zone 2A vascularization was seen in 10 or 76% of ARP babies with zone 1 disease, and 72% babies with ARP zone 2P disease. And after 5 weeks, zone 3 vascularization was seen in 7% of the ARP zone 1 babies and 27% of the zone 2P ARP babies. Limitation of our studies was it was a retrospective study with very small sample size without any comparison group or any wide field imaging. Laser was planned after a fixed interval for all babies to avoid disease recurrence, repeat injection, or possible general anesthesia. And long-term follow-up data would improve the safety analysis. To conclude, incidence of potentially blinding AROP is not insignificant in Eastern India. Biosimilar ranibizumab is followed by laser photocoagulation is a safe, economical, and effective treatment option. And all eyes could be managed with single anti-VEGF injection and single setting of PRP laser. And there is no safety concern in the short-term follow-up. This is the review literature by Dr. Lalit Verma et al. And Dr. Prajapati. Thank you for your kind attention.
It was a very nice study. After how many days the laser was carried out?
A median of 5 weeks, average 3 to 6 weeks.
Okay.
And after examining the avascular retina.
avascularity. If it still persists, are there any number of cases in which you don't need any laser? You didn't need, huh?
Actually, we did laser in all the cases after this fixed period to avoid any possible recurrence of disease or the babies growing. So it will be difficult to examine or treat them under topical anesthesia without any general anesthesia backup. So that's why we did laser after a fixed time.
Okay.
Do you think it is just
Yes. It was a blanket therapy with laser. Okay. Thank you, sir.